Welcome to Adapting Class. I've received numerous emails about fluid electrolyte. This video is a short video to make it easy. I think for you to master fluids, you have to know what they are. There's crystalloids and the colloids. So if you understand both of them, you'll be able to understand their usage and what you should expect when the patient needs a solution for a particular problem. So quick lecture, then a short questions to help you focus on it. So there's two types, okay? Two types of fluids you're supposed to know. One is crystalloid, this is colloid. You have to understand how they work, why we use it, and why we call it that, like that. Crystalloid, so I'll do each of them. Crystalloid is simple, very, very small molecule. It has small molecules that can move from places to places. It's easy to move around easily. And that's why we use them. It can move easily between the different compartments of your body. The interstitial space, the intravascular space, the extracellular space, these can move easily. That's the key. Okay, they don't stay in the intravascular system that long, so they can move around depending on situation. Okay, the biggest thing you have to know is, so don't stay in the intravascular system too long. So they can move around if they need to go to some space to ensure that the osmolarity from one space to another is the same. The key thing is they don't have too much complications in terms of these two, allergies or coagulation issue or bleeding issue. These are two things when we're transfusing this crystalloid and colloid, we worry about the allergy reaction to that, or you have a bleeding problem. So we can use it freely in surgery without any problem. Okay. They are for replacement. Okay. Replacement mostly. If you need some fluid, we need to replace it quickly, we can give it to you. There's different kind though. So you have to know the difference. They do not change the pressure of the system. They don't. They just basically can change the osmolarity of the extracellular fluid or intravascular fluid. The other one is the colloid. Okay, they're different. They're completely different structures altogether. So the colloid, as the name sounds, they want to look like albumin. You know, albumin in your body? Yeah. These are synthetic. So instead of making albumin, we cannot make it. We make these synthetic solutions to help with the function that look the same as albumin. Based on that, you know, albumin is a large molecule. Okay, it's a large molecule. That's what they have. And they are synthetic, like I told you. Large molecule, they cannot move easily. They cannot move easily because of their size. So they can't move from capillary system to go to another region. Wherever you put them, they stay there. So they stay in the intravascular system. And what do? They increase the oncotic pressure. And by doing that, they pull fluid out from places, out from probably interstitial space. So they can put fluid out of those space, intra-abdominal space, every places that you have edema, they can pull it and put it in the intravascular system, and they stay there. Okay, that is their main function. This is briefly what you need to know. And since these people, crystalloid does not cause allergy or coagulation. Yeah, these guys, because it's synthetic, you're making something that like your body, similar to your body albumin, sometimes your body react to that. So you can have allergic reaction to that. And unfortunately, it affects coagulation factors and platelet. And so you have like bleeding issue with that. So anybody getting this medication fluid, the form of medications, you have to prescribe it. It can cause bleeding and coagulation factors. This slide, you take a picture of it, you know the difference between a crystalloid and colloid. Okay, now let's look at what you have to pay attention to. This is what people get confused, crystalloids. Let's talk about a crystalloid. There's different kind of crystalloid. Okay, the crystalloid can be hypotonic, that's the tonicity of the solution, isotonic, and hypertonic. Pay attention. The tonicity is in relationship to our intravascular system. Okay, the tonicity is related to that, in reference to that. So our intravascular or extracellular system basically have certain tonicity, and that is the tonicity we're referring to. We all know we're referring to the plasma tonicity, which is always close to like 1%, basically 1%, like normal saline. It's close to that 1% based on the tonicity, or 285. That's the osmolarity. I don't want to bother you that much. This is the actual and osmotic pressure, a concentration of the extracellular fluid or intravascular fluid. So what they're referring to is that. So when they said tonicity, they're referring to this 285 osmolarity. So if anything changes, we call it different. So the fluid that you have, whether it's what crystalloid or isotonic, is related to that. Therefore, if you are hypotonic, you have to be less than 1%. So your concentration is less than 1% at least, or less than 285 osmolar, right? And that is hypotonic. That solution, if this is the solution, sitting here like that. So this is the solution, and this is the extracellular fluid or intravascular system. The relationship, this concentration is lower than that. That's all. That's hypotonic solution, right? Hypotonic solution. That's all. When you say isotonic, it's the same as that of plasma. And when you say hypertonic, it's greater than plasma. That's all. So you look at the constituent of the solution they're giving you and you say, would this be greater or the same or lower than plasma? And then you classify them based on their tonicity. Okay, so let's look at them. So first, we start with the isotonic. And we know we got to be close to like what, 0.9%, 1%. So we got to be close to that. So isotonic solution, normal saline, 0.9% is an isotonic solution. Lactate ringer, as the same as that, the plasma. And then this one, D5W, this is the same as 5% dextrose in water. This is isotonic when it's in a bottle sitting on the table. When it's in a bottle sitting on the table, yeah, it's an isotonic solution. The next one. hypo. That means it's less than 1%, right? Therefore, there's no concentration that should be greater than 0.9. So if they give you 0.5% of normal saline, this is the same as half normal saline. Here is half of the osmolar concentration. So this is hypotonic solution. Okay, let me use blue so that you can see. Right, that's the first one. The next one, if you keep on going down, 0.225% of the normal saline, yeah, that means half of this, you're going down isotonic, yeah, hypotonic solution. If you go a little bit up, 0.33%, that's hypotonic solution. Now, D5W, the same thing that we saw, if it's infused, yeah, it's hypotonic. Why? When we infuse the D5, okay, initially in the bottle is what? Isotonic. When you infuse it, the liver break it down and it becomes just water. You take away the dextrose out and it becomes just water. Okay, so that is why it becomes hypotonic solution. So these are your few hypotonic solutions. You don't have to memorize them. You can figure them out. Okay, so that's that one. Now, let's look at the hypertonic solution. They have to be greater than 1%. Right? So if you're greater than 1%, just pick a number. 3% normal saline is greater than that. 5% normal saline is greater than that. Right? Then you start thinking, okay, if I have normal saline, now bring your normal saline that you have. Oh, okay. Bring your normal saline. This is my normal saline. Okay. I already know it's isotonic. If I just had D5, something small to it, D5, W, I have created an hypertonic solution. Same thing, my LR. This is isotonic. If I just had D5, W, I have created what? Hypertonic solution. So keep on doing that, right? After the 3 and 5%, take the normal saline, take those isotonic, and just add D5Ws, and you created that. There's also 10%. Okay, dextrose, which is called, let me write it, D10. D10W, 10% of dextrose. That's 10% of dextrose, right? There's also D50. It's different from D5. That's 50% of the solution has sugar in it. That should be what? Hypertonic solution. So those are your cool stuff you have. Now, the best one that they always confuse you, you know your half normal, the 0.45%, okay, we know is hypotonic. If you just had D5W28, you've made it what? What have you made it? An hypertonic solution. So D5W plus 0.5% normal saline is hypertonic solution. So these are your hypertonic solution. These are your isotonic solution. These are your hypotonic. So when they give you a question, don't struggle. Just make it. You try to break it down. You can figure out where they fall. That's your crystalloids. What are they used for? This is usually for somebody who is like dehydrated. We want to give you a lot of fluid right away. Okay, somebody who had burn wound. Remember, mostly burn, we use lactate ringer. Okay, somebody who has severe dehydration or somebody is in shock and other thing, we give them crystalloid. Okay, most of the time we give them isotonic solution. Okay, instead of hypo or hyper. The other thing you should know, even though these are hypertonic solutions, the only one that is used for brain, ICP, is this. Number one is 3%. Okay, so if you have ICP issues, just choose 3%. Even though these are hypertonic, because of the dextrose, you don't want to use it that. You only use the 3%. That's all. Okay, now, colloid. We talk about it. They are volume expanders. We call it expanders. They expand your volume. They stay in the intravascular system and pull fluid to improve your pressure, on contact pressure, and it help with the fluid. There's few of them. Albumin is number one. There's 5%. There's albumin, 25%. It's just concentration of it. There's hydroxy. This is ether starch. Okay, ethyl starch. Some people will call it ether starch. Okay, that's another one. Okay, then there is a dextran 40. Okay, and there's gelatin. These medications are very, very strong. They are colloids that we use to expand our volume extracellularly. There's few things you have to know about that. Okay, they have allergic issue and coagulation problem. Okay, so that's what you have to pay attention to. If I give you dextran, for example, dextran, the affective von Willebrand factor. Okay, this is von Willebrand factor and factor 8 and platelet function. Therefore, this can affect your bleeding time, okay, your PTT and PT, basically. All these things, factors can be affected, so pay attention. The same thing applies to the S-span. S-span to do the same thing. They affect your coagulation, they affect von Willebrand factors, they affect some of the coagulation factors like fibrinogen and platelet dysfunction. So anybody receiving this, watch about bleeding and an allergic reaction. That's all. This is all you need to know for these colloid and crystalloid, what are examples, and how to remember them. Okay, so let's do some quick question. This is short video. So first question, we practicing. Which of the following the nurse should anticipate from the provider? This is how you break down question, right from the back, and the key word is anticipate. A nurse is caring for a client with what? Clear diluted urine of 6 liters in 24 hours. Urine specific gravity is this. Which of the following the nurse should anticipate from the provider? Don't start panicking. No. Anticipate. What would the provider provide? Okay, what should the order be? Then break down the question. I have a patient who had a lot of urine, 6 liters, 6 liters in 24 hours is not normal. What do you think? You're just pouring water. Patient is having free water. What disease process make you pour water just like that? Look at the specific gravity, 1.001. This is way low. This is the normal specific gravity. Okay, this is way low. It's down here. That means a diluted urine, the kidney is just pushing out water. What does that mean? Does this patient have diabetes? Do they have diabetes insipidus? Do they have SIDH? That's your differential diagnosis. It's a case form, you got to figure it out, right? A lot of water with a dilute urine and specific gravity that is low, diabetes insipidus. If it's diabetes mellitus, I will tell you the sugar. I never said anything. So this has to be diabetes insipidus, right? So if I'm in diabetes insipidus, okay, and I'm pouring a lot of water out, and my specific gravity is that I expect what? My blood osmolarity to be high. It's greater than 285. So high blood osmolarity, and my sodium is going to be high. If my sodium is going to be high, it's going to be hypertonic. So I have a hypertonic state outside my cell. Sodium is almost like 150. That's going to be high. Therefore, I have high sodium. I got to bring it down. How do you bring sodium down? Dilute it. So the 150, I'm assuming is 150 because normal is 145 or 160, whatever. But I have to bring it down. I have to give him something that is less than the 150. That means I have to give the patient what? Hypotonic solution. Which of these is hypotonic? You cannot give them 3%, it's hyper. You cannot give 0.9, it's iso. D5W is hypo when it go inside you. This is what? Iso. So the patient is getting D5W. Okay? So this is the same question you can ask you, diabetes insipidus. You replace what they're losing. What are they losing? Free water. So replace what they are losing. Number 2. Which order should the nurse question? A nurse receive an order for a client with what? Severe dehydration. I'm really, really dehydrated. You need replacement of fluid. Which one is best in replacing fluid? I have to give you that is isotonic. It's the best fluid resuscitation. Is this isotonic? No. Is this because when I put this inside you, it becomes hypotonic. Even though it's just sitting there outside, it's isotonic. Inside the cell, it's not. This is also hypotonic. This is iso. This is hypo. And this is iso. So 3 and 5 are right answers. Number 3. What is the next best action? A nurse receive an order for what? Blood transfusion. The client is currently receiving D5W. This is a content you got to bring of underlying keywords. Blood transfusion, best action, and D5W. Blood transfusion, best action, D5W. The examiner is not going to give you everything. You have to know your content that blood transfusion is only with normal saline. Only with normal saline, 0.9%. Is D5W more important than blood transfusion? No. So we got to stop this and give them the blood. Start the transfusion now. You got to stop the D5W. Wait until the D5W is finished. Don't worry about it. Stop the D5W. Prime the line with 0.9% normal saline and start the transfusion. Excellent. Prime the line with that. No, you only prime with normal saline. This is just bringing content together to answer this question. Test taking strategy. Number 4. What do we have? What is the next best action? The same thing, best action. And next receive an order to transfuse 25% albumin to a client. Transfuse it. Then you say, why am I giving this patient albumin? Then you tell yourself, what is albumin? It's a what? Colloid. What should I worry about? 2 things about colloid. Allergy and bleed. That's all. Why do you want to assess their leg edema? Why would this help you? We already know they're receiving albumin. That means they probably have ascites. Assess their lung function. A trap answer. Would that still help you that tell you anything about their albumin? Measure the abdominal girth. Is the same as edema. Would that help you? We are not doing paracentesis. If we are doing paracentesis, yeah, abdominal girth is fine. You got to do the initial one and then add test taking strategy. Check the allergy because allergy and bleeding are the main problem. Okay, so that's the right answer. And the last question. A client with severe ascites was receiving dextran for 40. Which of the following is concerning? Pay attention. Dextran is what? Dextran is colloid. What are the things you should worry about? Bleeding and coagulation problem. All of a sudden, temperature is high. Respiratory rate is going up. It's bleeding from the IV side. It's tachycardic and itchy. Or concerning. These are some of the things you have to start learning. When you see that, I know the content. I know what I'm looking for. I say, oh, this makes sense. And you pick the answer. Select or apply is not supposed to be that difficult. So you come up with your content. You never look at the answer choice unless you know what you're looking for. And when you come up with your content, you just breeze through. Okay? And you don't need to choose all of them for the current NCLEX. If they give you 10 multiple choice and you know 5, just pick the 5 and move on, unless they tell you to pick 5. So this is all I have for you. Thank you for watching. Short question on fluid and electrolyte, mostly fluid, to tell you the difference between crystalloid and colloid and use the questions to synthesize those information. Take care of yourself. If you have not subscribed, click down to support the channel and like, put a comment, and share it with your friends. Thank you for watching this video. Bye-bye.